Hey everybody, and welcome to the Home Health Recharge on the Senior Rehab Project. I'm your host, Troy Mead. Here at the Senior Rehab Project, we have a lot of members that contribute to their communities and to the group in different unique ways. And today we have an interview with just one of those such people. So sit back, relax, and enjoy the show. Hey, good morning everybody, and welcome to the Home Health Recharge here on the Senior Rehab Project. Today I'm joined with Patrice Hazan. Many of you may know her as an active member in the SRP group, as well as with the APTA population groups that are out there. So good morning, Patrice. How are you doing today?
Thank you. I'm doing very well.
Good, good. So for the listeners who may not be familiar with you, can you give us a little bit of background on who you are?
Sure. I am the owner of GroupHab Physical Therapy and Wellness, and GroupHab is an alternative delivery of physical therapy care, geriatric wellness care, that includes an integration of group exercise classes in addition to individual physical therapy treatment. So, an alternative model that continues to keep patients well after discharge and is designed also to try to help keep people from needing physical therapy in the first place.
Definitely an underutilized spot here in the community, as well as a different need that's out there. So your group that you have, or your facility that you have, is called GroupHab. Is that correct?
Yes, that's the name of my business, GroupHab. Yeah.
Go ahead. Tell us a little bit about it.
Sure, sure. Well, I started GroupHab just out of sheer frustration with the medical model of that, doing physical therapy, discharging with that home exercise program, which we know that patients don't keep up to for many reasons. And then having to kind of come back in a few months because they're not following their exercise or not exercising at home. And so they need the physical therapy again. So it was clearly a model that wasn't working. And I felt like there was a gap out there in the continuum of care for many of our patients that have multiple chronic conditions, patients that have complex medical needs. In terms of community services, any type of exercise program that continues to follow them and keep them well, I felt like there weren't enough opportunities for that type of exercise. So I opened GroupHab with the idea that I wanted to offer skilled group physical therapy exercise classes designed to keep patients well. So really a different model, a different way of using my physical therapy knowledge and experience working with patients to try to use that knowledge and develop a different model outside of the short-term therapy that we do to continue to keep them well. So I opened up GroupHab with just that idea that I have different functionally based classes, and I also do individual physical therapy. So I do that traditional medical model where we bill insurance, and then we have a cash-based program of the group exercise classes.
Very interesting. There's a lot of there's a lot of value there in thinking outside of the box and bringing a different model. What kind of outcomes or what kind of markers of success have you been seeing with this new model?
Oh my gosh, just fantastic, fantastic outcomes, and there is such a need for this, especially as we look at the aging population, the aging demographics, and the large number of older adults, that are they call it the senior tsunami that's facing us. So we're not going to be able to continue to provide physical therapy in the same way. There's just going to be far too many older adults, and we need to think of alternative ways to do things. So we do, of course, outcome measures on all of our group patients. Everybody who comes in for our group classes has to go through a physical therapy wellness assessment, of which we do a series of different objective measures. And we have this posted on our website, the results of the objective measures, how our outcomes are really great in terms of like the timed up and go, the 30-second sit to stand, the marching endurance test, grip, strength, all of those things. Patients that are coming to our classes are definitely getting stronger and better. So our outcomes are really good. I guess, of course, just on a day-to-day standpoint of seeing our patients, I can tell that we're just having a profound impact on improving the overall quality of their life. And just in terms of keeping them healthy and well, keeping them happy. The social aspect of this type of model is so important, and I feel like that also contributes to their exercise adherence and to their overall physical outcomes as well, because they come here, they have friends that check on them, they encourage each other in class. It's almost a little bit of a competition too. They want to try to keep up with each other in class as well. So the dynamics of having a small group setting has many, many benefits besides just simply completing exercises.
I'm sure it has a lot to do too with the overall satisfaction of the patients.
Yeah.
You're in more of a social model where it's not as much on one-on-one. There's value, like you said, there's still value in the one-on-one, but also, we're as humans more social creatures that like that competition and other things like that.
Yes. Well, this model is not, this model that I have right now, like group therapy is not supposed to replace individual therapy by any stretch. There's a place for individual therapy, but I think that there's a place for integration of individual therapy with the group for long-term outcomes. So we know that with our current medical model of the short-term and discharge with the home exercise program, patients are not compliant and their long-term outcomes are not good. When we follow them with this PT designed and supervised program, there's the opportunity there to prevent, first of all, like catch problems before they become serious concerns, but also to make sure that they adhere, they maintain the gains that they made with their physical therapy treatment.
That's kind of one of the difficulties with the profession is, once you're done with the individual therapy, you kind of let them go to their own devices.
The current medical model where we work with our patients and then we discharge them with the home exercise program, I would actually argue that a home exercise program is by nature insufficient, because we know that patients, in order to stay well, they need to have aerobic strengthening, balance, and flexibility. Well, our home exercise program, just being, essentially one piece of paper with a few exercises on it, is just not enough, even if they do it. We also know that patients need to continue to progress with their exercises. In other words, of course, getting harder in order to continue to make progress. We can do that in the group setting. We can also push them. We can increase the intensity of the exercises, and they can continue to make progress that way. We can challenge their balance. We know that patients, in order to really improve their balance, they need that wide range of challenges with vestibular, visual, all of those different challenges to really optimally improve their balance. So in a small group setting, we're able to really challenge their balance and help them to continue to improve in their balance. So there's so many reasons why that old model needs to be complemented with a model that includes group exercise classes that are led, and designed by a physical therapist, or supervised. At least we say designed, physical therapy designed and supervised. So we supervise the entire program.
Well, it sounds like you got a lot of great things going on. So what advice would you give to someone or a therapist that was interested in kind of bringing that kind of model to their community?
I would like to encourage any therapist who's really interested in opening a practice to consider opening a geriatric wellness clinic like GroupHab. So you could use this exact same model. It's an excellent, excellent business model. We've been able to thrive in this brutal environment of referrals, where most of our referrals typically from the hospital just stick right with the hospital system. So it's pretty difficult for small practices to thrive. We've been able to really thrive and grow and do exceptionally well because we have this alternative model. So I would suggest to any therapist, wanting to open a clinic, that you do this geriatric wellness, and the two types of programs, that individual physical therapy and the group therapy, they feed each other. So from a business standpoint, if you are offering group classes, let's say, for example, I put an ad out in the paper and the ad says, do you have difficulty with your walking? Are you worried about falling? Come try our group exercise classes that are, designed and supervised by a physical therapist. So your patient comes in, and typically what happens is they come in because obviously they have some mobility issues. So when we start to do that initial assessment, we find that, oh my goodness, you haven't had physical therapy this year and you've had lots of falls. And so typically we find that they might need some individual therapy before they actually begin our group classes. So that would bring in some referrals in that way. So often we'll do the individual therapy and then they'll transition into our group classes. And then in terms of the group classes, if any of our patients need physical therapy while they're going through group, they choose us for their physical therapy needs. And our best source of marketing is actually our patients. Our patients love our program and they market for us. They tell their doctors, they tell their friends, they tell their family members, and that also helps to bring in patients into our clinic. The other thing is, once we have an individual patient, let's say a doctor refers a patient to us, and then we try to incorporate some of the group exercise before the patient's discharge, so to kind of introduce them to the concept of continuing to exercise with the group. And over 60% of our patients decide to stay on with our group exercise classes. So that way the individual treatment actually feeds into the group classes. So as you can see, both of those businesses greatly complement one another. And so from a business standpoint, it's an excellent business model. Now, from a personal standpoint, as a physical therapist, it is so very, very rewarding to see your patients stay well, to get to really know them, where they come in on a regular basis and you follow them. If they have any concerns, they can reach out to you right away. You can prevent problems before they become serious, concerns by just that earlier intervention. So I would really encourage any therapist who, really has a passion for wellness, who wants to keep patients well, who really wants, is a little tired of that old medical model where you discharge with that home program and then you see them a few months later. And anyone who's interested in possibly having a successful business, I would really encourage you to try this type of practice.
Yeah, it seems like you get to see with this model, you get to see the outcomes, you get the prevention, you get the patient satisfaction. It's just all around a great model to have.
Yeah. Yeah. Oh, I could not agree more. I feel like, professionally, I feel like we need to change the way we practice so we keep our patients well. So we kind of change a model of how we practice. So I would actually like this model to be one that is my goal, actually, kind of my vision goal, whatever you want to call it, is to really help spread this model so that we can treat our patients differently. We say, change the way you think about physical therapy. That basically, and this is actually, I say change the way you think about physical therapy because when I think about some of the challenges of offering this type of business is to really educate the public and educate other healthcare providers in exactly what we're doing, how skilled physical therapy can occur in a group setting to keep patients well. So unfortunately, group therapy has a bad connotation because of, unfortunately, the history of maybe some poor group exercise, if you think about a setting where someone might be just sitting doing some leg kicks or something. This is so far from that. We use music, we do power moves, we do little jumps, we do all types of high-level balance exercises. Everyone gets an assessment before they even go into the group classes. So we have different functionally based classes so that we have actually 8 different levels so that when a patient is placed in the class that that is the correct level for that patient, so the patient can feel comfortable knowing that everyone else in the class is at about the same functional level and they can work that way to their maximum potential safely and comfortably. So we're able to really work to everyone's best ability, and it is just such a good model in that way too.
And I can see with the assessment too that it almost, obviously you can't eliminate completely, but it does minimize the risk of the patient, injuring themselves by taking on too much or going into a group class that may be too much for them.
Right. Right. It's the difference in a physical therapy design program here is that there is so much thought that goes into this, and we have the different functionally based classes. We have the assessment process that everyone has to go through that first, and then they're placed in the correct functionally based class. We have different exercises every single class, so you're not going to come and get the same basic routine. We use music, and we try to include elements of power. All of our classes all of our wellness classes include that aerobics, strengthening, balance, and flexibility. So even for our very most frail individuals, they will stand at the bar and they will hold onto the bar and do different types of aerobic exercise. We call them aerobic intervals actually, because they're, shorter period of time, of course. But the point is that they're getting their heart rate up. And so we're really trying to work on improving their cardiovascular status too. So really, designing the appropriate level, very, very challenging class to continue to keep them well.
Well, I definitely think you're preaching to the choir on this one.
Okay, good.
In the past, sometimes there seemed to have been like a wall between this type of skilled intervention and as well as, just the individual, intervention. And I'm glad to see that it's being incorporated and it flows and it said if one feeds into the other and at the end of the day, it results in better outcomes to our patients. So
yeah, long-term outcomes. So you continue to keep them well longer term. And when you think about how the medical model is changing, rightfully so, to wellness and prevention, I mean, this fits right into that category. And as physical therapists, we need to practice in that area of prevention. So this, absolutely fits into that category. And I know just from my clinic here that this model would save Medicare so much money, because there's many patients actually that have been coming to our group classes that would have needed individual therapy, and they haven't needed it, so that because they've been following up, coming to our classes.
Yeah, the prevention model definitely, if you're going to look from a financial perspective, is much more beneficial than it's broken, now let's fix it kind of model. So
one thing I did want to stress, actually, when I think about, I'm encouraging other physical therapists to do that, but I want to let you know, even just professionally, of some of the challenges. One of the biggest challenges I feel is really educating other therapists, other healthcare providers, and the community how what we're doing is different. And so it comes into, really falling back on some of those evidence-based principles that we know that you need in terms of exercise. So we have that physical therapy assessment to place them in the right class. And then, like I mentioned, you're going to fall back on the fact that we know patients need to continue to progress. So if you don't increase the difficulty of the exercises, they won't continue to progress. You know that exercises need to be intense enough in order to show progress. So if they're at home doing some simple exercises that are not challenging enough, they're not going to continue to show progress. We go back to the neuroplasticity, that they need to have all of those wide range of challenges with their balanced exercises. They need to just about lose their balance in order to really, really improve their balance. And then you think about fall prevention, all of the money that we could save trying to help prevent falls with this type of model. There's so many evidence-based principles that go into the design and of the group exercise and the model of offering group exercise. And so when people think, oh, group exercise, that they kind of minimize it, I would say, thinking that it's not skilled, it's not something that we should do as therapists. I am telling you that we should do this as therapists. And if you think about a patient, okay, we know how hard it is to work with one patient that has complex medical needs, managing multiple chronic conditions. Just think how hard it would be to work with 5 of them in one class. And then this is something that we're going to give to the community to handle. I feel like no way we should step up as physical therapists, and those difficult, challenging patients with multiple complex needs, we need to really design and implement and follow through with programs to keep them well.
Almost there's a need for a rebranding of group therapy as you would currently think of it.
Yes, that's a perfect way to put it. It would definitely need rebranding. Yes.
So is there anything else you'd like to add?
No, I just appreciate the opportunity to speak with you today, and I appreciate the opportunity to contribute to that senior rehab Facebook group that you have. It's just such a fantastic group of individuals and such forward-thinking people that it's just such a refreshing group, and I really enjoy following it, and I've enjoyed the opportunity to be able to, give some videos of my classes and things as well.
Yeah, well, we definitely appreciate you and everybody else who's also a member. So the goal is to have a safe place to kind of push clinical practice and share ideas where no one feels judged, or you can come out with different ideas. So I think we definitely have that goal going for us, and a lot of it has to do with people like you that are doing a lot of great things out there in the community for our patients.
Oh, thank you. Yeah, it's a fantastic group, and Yeah, like I said, it's really refreshing because sometimes when you do have ideas that are different from the norm, you will get some critics, of course. So you have to kind of have that kind of forward thinking and change kind of attitude to accept things that are different.
Absolutely. Well, I appreciate your time, and thank you again for joining us.
Thank you. Thank you so much, Troy.
Thank you for listening to the Senior Rehab Project. If you gained from this episode, consider supporting our work. You can become a patron through Patreon, a service that allows people like you to support people like us. You can give as little as $1 a month or become a game changer for $8.99 a month, where you get this awesome redefined old mug and access to our monthly meetups. They're really a blast. Just go to theseniorrehabproject.com to learn more and find the show notes for this episode. Talk to you soon, and don't forget to stay funky.